I think of myself or a family member, and we just talk. I have a lot of patients that call in, they actually looking for a friend or somebody to talk to, especially with the oncology patients. They're calling in, they're scared. I let them know it's going to be okay. I'm here for them now, and if they need to call back.
I've been a patient of surgery, and so I like to think of it as the people that are calling are like myself or like my family members, and so I try to put myself in their shoes and show a lot of compassion and empathy for their situation, because surgery can be scary for a lot of people. And so I just like to think if they're scared, we can be comforting. If they're nervous, we're here to reassure them and let them know that they have some of the best doctors in the country here. I'm the front line, and I just want to make sure that their first experience is the best they can have.
That is a challenge with some calls. Some calls are just naturally easy if they're my age group, or I feel connected to them. It's easier to do, but there's always something that you can connect with somebody about. Sometimes it works and sometimes it doesn't.
That we're usually their first or second contact, even before they get into the office to see the physician. So if we impact the patient positively, then pretty much even going into their check-in to get into the office visit, it starts at level 1, because they remember that first person that they talk to. If that person is pleasant, then hopefully the whole process will be pleasant for them.
We design the schedules, the master schedules for the Emory Clinic providers, so that the patients can be properly placed so that it'll go 100%.
And one of the new things that we're doing is we're making sure that we optimize physician schedules to fit patient needs to the maximum.
If this is the doctor that your child last saw prior to leaving?
I am so awesome, and I make the patients laugh. Even if they call in on a bad day, I have to get them to laugh. So yes, I would like to talk to myself.
Let them vent. Most of them just want somebody to vent to, and you just sit there and listen, and you acknowledge it, and by the end of that, most of them okay.
I have a lot of callers thank me, thank you for caring and thank you for being nice, and I'm like, shouldn't have to thank me for being nice. I think that's my job.
And I was going through all day long, and but you answered this time and resolved our issues. You were so kind, so nice to me. So yeah, I do think they feel I care, definitely.
I think guided scheduling will provide agents with a great opportunity to get themselves through centricity without all the hang-ups of sometimes the system crashes, sometimes you may be in a rush, you may, have a referring office on the phone, and it just helps you get to the next step of scheduling that appointment. I think it's going to add an extra cushioning to what we do around here.
People sometimes are upset that they've had to call in multiple times, and that's understandable. But they're frustrated. They don't want to hear anything other than you have my situation resolved. Continue to give them that kindness regardless of how they're treating you, and ultimately you're able to win them over 9 times out of 10.
We sort of do with doctors, because they'll be the ones that will have direct patient contact, but by optimizing their schedules, making sure that it's used to the fullest, making sure that patients don't have wait times, different things like that.
Now I'm no longer the person that caused the problem, which is how you first entered the conversation. Now I'm the person who you're connecting with, who you're talking about, and say, all right, well, who do we need to attack together to turn this around, to fix this? And that's what we end up doing. And so it works out pretty well most of the time.